Hi, I'm Dr. Ted, and this is Fracture Friday. For this episode, I have an ankle fracture. But to me, it's an interesting ankle fracture because it involves the syndesmotic ligament. Syndesmotic ligament is a ligament that's in between your tibia and fibula. It runs all the way from the knee all the way down to the ankle and maintains the space between those two bones. It also helps to keep the ankle stable. It maintains the ankle mortise. So when we talk about an ankle mortise, it's basically the tibia that's kind of shaped like this, then you have the fibula, it's like my thumb, and then you basically have a talus that sits in between there. So you have to have stability between those two bones to maintain stability in your ankle. So we have to reconstruct the syndesmotic ligament if it's torn. So in this first x-ray that I have here, it's a very dramatic x-ray because the foot is very displaced in relation to the distal tibia and the fibula. But it also has a high fibular fracture, meaning that the fracture is way up on the fibula, which means that the syndesmotic ligament had to tear for that to happen. So we know that. We'll check for that in the operating room after we fix the fracture to make sure that the ankle mortise has been reconstructed. For this particular patient, the syndesmotic ligament was still loose after fixing the tibia and fibula, so it required further fixation. So in these post-op x-rays, another AP here of the ankle, you see that there's a couple screws in what we call the medial malleolus, or the distal aspect of the tibia. There's a bunch of screws and a plate on the distal aspect of the fibula to hold that in place. But there's also two horizontal screws that run between those two bones to support and reconstruct that syndesmotic ligament and allow for it to heal. The interesting thing about that as well is that a lot of times we have to go back and take these syndesmotic ligament screws out because of the motion that happens at this ligament, and it will cause the fracture, or I'm sorry, the screws to eventually break once the fracture heals. Thanks for watching. Hi, Dr. Ted. Thanks for sticking around after the video. If you'd like to see some more content from us, please subscribe to the channel and like this video.